My name is Rochelle Paul Brothers. I'm from the Chicago Department of Public Health Office of Research, and I would like to welcome you to our Community Research Council meeting today. I am very excited to see all of you and really grateful that you take time out of your busy schedule to join us in today's conversation. So today is the first meeting of three that the Research Council is planning to have around housing and food insecurity. Next slide, please. And because of the number of participants, we won't be able to go around and introduce ourselves. And I'm so glad for those of you who have already started doing so in the chat. But I wanted to take a few minutes to acknowledge the member of the Research Council and also members of the Planning Committee very quickly, and also acknowledge the facilitators who are going to be guide the discussion in the different, in the two breakout session that we're going to have in a few minutes. So very quickly in the planning committee, I would like to introduce you, and then members can just have like a virtual wave from their screen for people to know who they are, and you'll have a chance to interact with them in your breakout room as well. So from the UIC Office of Community Engagement and Neighborhood Health Partnership, we have Dr. Angela Odom-Young and Sabrina Nelson and Dalen, who just joined us today. Happy to see you. From the Habilitative Center System, we have Ms. Deborah William. From the Alliance for Health Equity, we have Sydney Edmond here, who is also our tech person, is handling all the behind the scenes work. So thank you, Sydney, for all your hard work. And from the Alliance for Research in Chicagoland Committee, we have Ariel Thomas-Sensing. And the facilitator who's going to be helping guide the conversation, we have for the housing breaking room session, we have Corey Darling for Heartland Human Care Services, and also Dr. Janice Smith from the Vore Center. And I think one of the colleagues from Heartland is also here, Rob, so you can also wave at everyone, Rob. And for the food group, we have from the Greater Chicago Food Depository, Taryn McCook, and from DePaul University, Dr. Howard Rosin. So we are very grateful that they have agreed to help us facilitate this event and also take time out of their schedule to help us out in the discussion. So today's discussion is really to help us have a discussion around community-driven approach and solution with a recent lens around food insecurity and housing. So I would like to take a few minutes to give you guys a little background about what the Research Council is about. So the Research Council is a working group that was formed back in 2019 and was created out of the Office of Community Engagement for Neighborhood and Partnership, and is co-chaired by UIC, by the Habilitative System, and by the Chicago Department of Public Health. And so the mission of the Research Council is really to work with community partners to create research agenda, community-driven agenda, around topic that is relevant to our community members, because we want to make sure that community have a say-so on the type of research that being done in their community, both from the implementation to the design and the execution of this. And the building on issue identified Healthy Chicago 2025, which we'll hear more about it from our Director of Health Equity, Ms. Jenny Turner. We have decided to select housing and food as the focus of our work for this year, as many communities have been impacted during the COVID pandemic that we face it. Next slide, please. So today's conversation, which is meeting number one, is really to level set the conversation and identify past and current initiative, community assets, and gaps. The ultimate goal of those conversations, like I said, is the first of three meetings, is really to create this research agenda around food access or food insecurity and housing, but also identify evaluation in some of the initiatives that are currently taking place, encourage partnership between community organization and academic institution. And I'm so glad to see all of you being here today, and also explore research questions around Healthy Chicago 2025. So for the research question piece, we will mostly discuss those in our second meeting the date hasn't been finalized yet, but hopefully very soon we'll be able to share with you the date of that second meeting. And for that second meeting, it will be just that identifying the research question based on the information that we will identify from today's meeting. And the third meeting will be really to discuss potential initiative, research project, and also partnership to help answer the different questions that we'll come up with in meeting number 2. So as you can see, all those meetings are connected, and we hope that you'll be joining us for all 3 meetings and helping us shape this research agenda around those 2 priority areas, food access and housing. So to kick us off in our conversation, I'm going to ask Jenny Turner from the Chicago Department of Public Health, which is our Director of Health Equity and Strategic Partnership, to give us a brief overview of Healthy Chicago 2025. So Jenny, please take it away.
Good afternoon, everybody. So what I'm going to be doing is, as Rochelle just stated, is kind of giving you an overview, high-level overview of the Healthy Chicago Community Health Improvement Plan, current version, Healthy Chicago 2025. Talk about the themes and initiatives tied to that, our change process, highlight the specific items around food and housing, talk about some of the Healthy Chicago 2025 actions happening now, and then open it up for some quick questions. So Healthy Chicago 2025 overall vision is basically a city where all peoples and all communities have power, free from oppression, are strengthened by equitable access to resources, environments, and opportunities that promote optimal health and well-being. And I'm sure as those of you who have been involved in health equity and equity for a while know that this is a big statement and it's going to take a lot of work to get us there. When we launched last fall, we asked people as they were registering for the launch event, what were words that they could use to describe a healthy Chicago. And you could see all kinds of things that came out in there, able to breathe, arts that it's flourishing, where everyone matters, resiliency, togetherness. And the background information as to what led the current version of Healthy Chicago planning is around our life expectancy decreases that we're seeing for all race and ethnicities, with the exceptions of white Chicagoans. And I forgot again to put the colors on here. When we send this out to everybody, I'll make sure I have the matching. But purple is African-American, red is white Caucasian, green is Latinx, and blue is, green is Asian and blue is Latinx. And these factors are driven by chronic disease, gun-related homicides, infant mortality, HIV, infectious disease, and overdose. And so, as you are probably also all aware of, is that these issues were exacerbated when it came to life expectancy in the midst of our current pandemic situation. So level setting, just because I know we have quite a mix of audience here today, looking at the Robert Woods Johnson Foundation definition of health equity means that everybody has a fair and just opportunity to be as healthy as possible. And to achieve that, we got to remove obstacles such as poverty, power imbalances, lack of access to good jobs, unsafe environment, and institutional and structural racism. So what Healthy Chicago 2025 actually does is build on our previous plan released about 5 years ago, which was Healthy Chicago 2.0, which basically moves some of our direct focus that was on this spectrum around disease, injury, and risk behaviors, and put a lot more focus on this bottom section here, such as the institutional and social inequities. So you will hopefully see that as I continue through this review. So in the document itself, and if you just Google Healthy Chicago 2025, you can get to it, but we will have a link for it. We said to achieve the vision that we needed to focus on 4 themes. And when this we is the big we in public health, this included a lot of workshops and input directly from the community. And those themes basically congealed into 4 major areas, which was to improve the systems of care for populations most affected by these health inequities, further the health and vibrancy of the neighborhoods, strengthen the community capacity and youth leadership, and then transform policies and processes to foster anti-racist multicultural systems. And so when we looked at the larger picture for those themes, we said, well, we need to try to kind of like narrow down what we're really going to be working on. So the assessment pulled out some priority areas. And you'll see, of course, housing and food are the first 2 listed, but there's also environment, public safety, neighborhood planning and development, health and human services, and public health systems organizations. We said that we need to address the inequities in those areas with the focus on those populations which were experiencing the inequities, so that an ideal state, within 1 generation, any public health improvement plan is not going to solve all problems in a 5-year period. So we're saying, what is our North Star that we're trying to really reach for? So in 1 generation, we want people to have healthy, affordable homes, nutritious food and local food businesses, be able to bring clean, fresh air, have a safe city, vibrant neighborhoods, have access to a full range of health and human services, and have a voice and power in the public health systems to achieve this vision. So this is cross-sectored within and outside of city government. It's community focused, and we are trying to right now continue with our implementation planning in the midst of our COVID planning. So this is not a magic fix. It's not like we published a document and all is well in our world. This is system level changes that takes a lot of work. There are ordinances, there are laws, there's all kind of things that are barriers that must be broken down and pushed through to actually create the vision that we want to see. So how are we going to start this work? Because it can feel a little overwhelming at times. So we use our Healthy Chicago 2025 guiding principles as we start talking about how to affect change in the systems that we're dealing with today. We want to make sure that we actively challenge and redress racist systems through our process and strategies. We want to highlight community strengths and cultures. As we tell the stories, we want to consider who benefits and who burdens by proposed solutions. We want to make sure that we recognize the impact of trauma on individuals, communities, organizations, and systems. And we want to support resilience and healing. We want to promote community wealth and affordability and belonging. We want to make sure that community members, especially our youth and young adults, have a power in decision making. So this is what we use and we come back to, and we actually ask our partners to use as well inside and outside of city government as they are developing new programs, processes, and procedures, as well as analyzing their current ones. So what does the change process look like? Using the guiding principles, we want to make sure that we're working with the communities to collect and analyze all kinds of data to identify the assets and the inequities. And then we want to support the people to co-own solutions because we know that community-led is the way that we really make sure that we affect the change that we want to see at the systems. And then we have to advance the policy and systems and environmental changes that we are living in at all levels. And we need to continually evaluate whether these changes are successful in closing those life expectancy gaps. And then we kind of just continue this process over and over again. Once again, not a magic fix, small steps, continuing to move forward until we break down the barriers. So now I'm going to highlight what you will find in the document in much greater detail, but this piece is specifically on food access. So once again, for the overarching themes for the priority area for food access, we say we want to specifically will focus on Black, Latinx, and low income Chicagoans as the populations identified as in the data as experiencing inequities. And that, the ideal state within one generation, 25, 30 years, have enough nutritious food and local food businesses thrive. That's an ideal state. But how do we really get to that? So some of the ideas that came from our community work groups was publishing a food environment map, establishing a food policy initiative and advisory group to advance food equity and justice, and using public health data to strengthen policy plans and practice to increase equitable access to healthy food, strengthen the food safety net, and support local food producers and businesses. And those of you who are in the food access world know that a lot of this work is already happening with some of our great partners out there, as well as a push from the mayor's office to establishing some food policies from the city level. And then we started looking at, well, what would be some equity measures that we want to start measuring? Knowing this is not a full list, but just some initial ideas of what we could measure is increase in healthy food access and of course, that would be decrease in food security or increase in food security, decrease in food insecurity, and then how we are investing in local food processors, producers, and businesses. A lot of work going on with Invest Southwest, as well as some other ideas being floated around about how do we specifically invest in food businesses. So that's food. And once again, these are not a full plan. These are just like some of the initial ideas. We know that there's a lot more work that's coming out there and coming from the community as we look into how we are resourcing some of these community led ideas. Moving on to the food side, the housing side. Population experiencing inequities are actually the same, and I realize I need to change the slide, but this part is all correct as far as what the plans for change are, evaluate and align funding across home assessment and repair programs, youth health data to prioritize buildings for proactive healthy homes inspections, and train developers to co-create health action plans with residents in the area, and apply a health criteria to housing resources allocations, including the city qualified allocation plan and TIF and low income housing trust fund. Some of the equity measures that we're thinking would apply here are reducing health hazards in the home environment and increasing availability of affordable and supportive housing. For all the other areas, you can see the document for the plan for change and equity measures for those as well. So this piece here just talks about the overall measuring progress for the full Healthy Chicago 2025 plan. What we plan to do is work with the community and various organizations within the city government to develop a citywide equity dashboard. But we know that there are some indicators in the data sets right now that we can just continue to use to monitor how we're doing on improving the overall community health. Those being life expectancy, overall health status, economic well-being, and mental well-being. These are things that we track and analyze today. And projects and work related to this work, to the health improvement plan. Within the city, we are developing a program for health equity in all policies throughout the city. This is a huge undertaking that we are doing this year, working with our sister organizations to really identify steps to analyze existing policies and new policies to ensure that equity is being built in it from the get-go. One of those pieces is the Health and Racial Equity Impact Assessment Toolkits, which are being developed both for city departments as well as a toolkit that will be available for community organizations. We have a new document related to Healthy Chicago 2025 that's in the process of being released shortly, the State of Black Health in Chicago. We are also working on a citywide planning process, which is taking a serious look at to how to build equity into the citywide planning. CDPH is doing the strategic plan, which also includes our racial equity and equity plan in that. I already mentioned the citywide equity dashboard. And if you are not familiar with the Together We Heal racial healing initiative coming out of the mayor's office, I suggest you take a look into that as well. Initial kind of pilot activity took place between December and January, which was, I felt, very well received. So with that, are there any questions? And here's some contact information and the link to find out Healthy Chicago 2025.
Thank you, Jenny. I mean, that was great. And I think we have time for maybe one question. If somebody wants to unmute themselves and ask the question.
I have a
Now is the
question.
time. Sure, go ahead.
I'm wondering if this is going to be looked at again in light of the fact that many renters will lose their homes after the rental assistance runs out, the huge amount that's coming into the city, and whether you're going to be looking at this plan again in light of COVID-19. That just exacerbates, food and housing insecurity.
Yeah, I didn't pull those pieces just for time, but in the document, there actually is a COVID-19 case study, and that was taken into account. In fact, this plan was originally supposed to be released in April of last year, but due to COVID, it was put on pause. And then when we came back to it, we really did take a look at the COVID situation when we put together the full document. In relation to the housing and the assistance for housing, I know the Department of Housing is definitely working on some specific activities related to that. In fact, I just released our RFP yesterday. We actually have Department of Housing on the call today. They will be in the breakout sessions and can answer those questions in more detail about that. But CDPH is itself working through things like the Alliance for Health Equity to identify ways that we might help lessen the impact of the housing crisis.
Thank you, Jenny. And at this time, we're gonna be put in breakout rooms. So Sydney is gonna explain to us how we're gonna do it and how the process will happen. Sydney?
Yeah, hi everyone, good afternoon. Sydney Edmond, I'm a program manager for the Alliance for Health Equity. I am about to split everyone into two breakout groups, so Group A and Group B, where you will be until about 4:40, 4:45 until this afternoon. And in those two breakout sessions, we will be, one will be discussing the food security side and another will be discussing the housing insecurity side, and then halfway through we'll make a switch, but we're only switching the facilitators. So whatever breakout group, Group A or Group B you're in, you'll be in that group for the remainder of the afternoon. And if you need any help, you can put your questions in the chat, or you can press the ask for help button that'll be at the bottom. So I am about to move everyone, which will take a few seconds, so bear with me.
I don't know if this has been announced while people are joining. Our office is hosting a Latinx think tank on Thursday, March 25th at 3 o'clock. It will be done in Spanish. It will be hosted and facilitated by someone from Telemundo. We have 4 phenomenal people who will be giving presentations. If you want more information, please email Sabrina, but we can certainly send information out to this listserv so you can share with people who may be interested, but it's talking about COVID and the COVID vaccine for our Latinx community. Sabrina, can we even post it in the chat? Let me see. I'll post it.
Give me a minute. I'm not sure if I have it saved on this.
I got it. I got it saved.
Okay.
Well, I'll have the newest one saved, but I'll keep trying before I go for my meeting in 4 minutes.
And Angela, I don't know if you introduced yourself to the entire group. I don't
Didn't.
breakout. And so maybe Angela Ellison is the director of the Office of Community Engagement and Neighborhood Health Partnerships at UIC.
Welcome, everybody. Thank you for joining us. I'll let you wrap this thing up. Thank you for taking your time out of your day. I hope to see you again next time.
So I know we're down to 3 minutes and Rochelle kicked us off. And I know we have several members here that you got a chance to meet the planning committee, but this is a 3-meeting series. And so the next session, we're really going to dig deeper into coming up with some research questions because we're developing a community-driven research agenda and to think more about how to bring, as Rochelle mentioned, things to scale, how to look at very community-partnered, community-informed and responsive work. I'm not sure, Rochelle, I know you were coming off mute. Did you want to add something?
Oh, no, sorry, it's just my, it was like my computer was acting up though. Don't mind me.
So I'm not sure if anybody else from the planning committee has any closing comments, but we hope that you will join us for the next session. And we will send out information, the registration link, because the goal at the end of this is not just, we have these one-time events. We want to make sure that at the end of this, we have some products that can be put into practice where we actually conduct research to move the Healthy Chicago 2025 agenda forward. So I wasn't sure, Deborah or Sydney, Ariel, if you wanted to add anything before we close.
Hi, everyone. That was excellent. I just want to let you all know that we were taking notes, so we look forward to sharing all this information and the resources that were shared today with you all, and just look forward to building solutions together and acknowledging all the work that has previously been done. We want to make sure that we're moving forward and acknowledging the efforts and the knowledge that is already at hand. So we want to enhance the conversation. So thank you all for participating.
And I would just like to say thank you all for participating. It was a great turnout, but feel free to invite some of your constituents, some of your community members to our next meeting. We want this discussion to be well attended, and we want to involve the community. So, but thank you all the experts here on the line in these industries, but please feel free to invite the community out to our next one. Thank you.
Yes, and again to our facilitators, that was phenomenal. So
Yes.
We appreciate you taking time to facilitate the discussions and providing your expertise.
And we put a link in the chat for anyone that didn't have a chance to submit their thoughts today. So you can continue to add in that form if you would like.
Thank you all. It was a pleasure seeing you all and looking forward to see you at meeting number 2. Have a great evening, everyone.